Hi, I'm Marty Jolly, Director of Nursing from Dakota Abilities. I'm going to go ahead and teach you about how to care for a person's feeding tube and the different types of feeding tubes that you're going to come into contact with here at Dakota Abilities. A feeding tube is just a tube that's placed through an opening in the body to get nutrition into the person when they're not able to take it in orally. Some people have a feeding tube just for their medications, so they're able to eat orally, but they need a feeding tube for the medications. There are people who have swallowing difficulties and they're at risk for food going into their airway. And so in those individuals, they might have a feeding tube to keep food from going into their airway when they're eating or swallowing. There's also other people who might have a feeding tube just to take their medications through because they dislike taking medications by mouth, so they might eat orally and take the medications via feeding tube. Others might have a feeding tube just for the times when they're not eating enough nutrition orally to supplement that nutrition, and we can put it directly into the stomach or into the intestinal tract to get the body the nutrition that it needs. So a G-tube stands for a gastric tube. Gastric is your stomach. So when you think, if you hear the term G-tube, think gastric, and with gastric, think stomach. Stomach is the big holding tank that we have. When you think of a person who's in a hot dog eating contest and they're eating all those hot dogs, where are they going? They're going into the stomach, and then that person has to try to digest them from there. Gives you an idea of how much the room the stomach has to hold those contents that a person is taking in. So G-tube is going directly into the stomach through a hole that the physician makes in the front of the abdomen. A J-tube is a tube that's going into the jejunum. The jejunum is past the stomach in the small intestine. So just past the stomach is where the jejunum sits. So that's part of the small intestine, and it does not have a big holding tank. It's a small tube that's flowing and then flows through the small intestine to the large intestine. So if someone has a J-tube, they can't take as much nutrition at one time as a person with a G-tube because the G, or gastric holding tank, has a lot more room and capability of holding. What does that mean for you? Well, it's one way for you to help determine, just by the type of feeding that a person gets, what type of tube they have. If a person is getting a large amount of tube feeding in less than 10 minutes, what we call a bolus feeding, then you know that person has a G-tube. Because in order to give them a large amount of feeding at one time, it has to go into a large holding tank. Now, if you support someone who's on a feeding pump and their nutrition is given very slowly via the pump over 24 hours or 12 hours, that person most likely has a J-tube. So that feeding has to go in at a much smaller amount and very slowly for it to be able to work its way into the intestine. The jejunum can't hold a large amount of food at the same time. Now, there are some people that have a combination of a G/J-tube. And what that means is the tube first goes into the stomach and there's a hole that empties into the stomach. And then further down the tube that goes into the jejunum, there's a hole at the end of the tube when it sits in the jejunum. So technically, with a G or J tube, there's two different ports that you could put the feeding into. One would be into the gastric area or the stomach. The other port would go right into the jejunum. Typically, if someone has a G/J tube, their feeding is going to go into the jejunum or the J port. And when you look at your tubes, they'll actually tell you what kind of tube they are in writing on the tube itself. So there will be a little band around the tube that tells you what type of tube it is. So it may say G-tube, J-tube, or GJ. And that's also another way to know what type of tube that person has. We're going to go ahead and look at what the different types of tubes can look like. So a standard gastric feeding tube can look like this, very similar to the look of a catheter. Actually, the first feeding tubes were just catheters. And insurance, when they reimburse for a feeding tube, only likes to reimburse at the cost of a catheter because it's much cheaper than the cost of a feeding tube. This individual has a low profile tube, which is called a Mickey. The Mickey device actually has a little cover that you flip open and then you connect the extension tubing to it. So instead of having a longer tube that's hanging out of the person's body from the tube feeding site, there's just this little low profile device that's there, and we connect a tube to that when we need to give the person meds or feeding through that feeding tube. How we connect them to that, let's go ahead and move these right over here. On this extension, there's a little line, and there's also a little line when I flip open the top of this, and I just line up those two lines, and then I turn it. It tells me to turn it clockwise. I turn it clockwise. Once I do that, it's actually connected firmly. So I've locked it in place. When I want to remove it, I just turn it back so the lines are right next to each other, and then I can go ahead and pull it apart. So when I'm all done giving that person their feeding, I can take this apart, flush this out with water, and let it air dry. The other thing that you're going to notice with a feeding tube is that there might be two connection areas. One of them typically has a colored ring around it that says BAL. BAL stands for balloon. And what the balloon is actually a balloon that helps hold the device in the person's body. So watch while I fill this with air. Now, I've filled that balloon. So this balloon would go into the inside of the body, and then if it got tugged on, it wouldn't come out of the person's body. So it's helping to keep whatever medical device that is inside that person's body. Tube like this has a purple balloon on it, and once again, to blow up this balloon, and blowing up the balloon is something that only a nurse would do, but there we go. And you can see where the balloon sits onto this feeding tube, okay? So that would be inside the body, that balloon, and that's what's gonna hold it in place. To release the balloon, the nurse basically just lets the fluid that's in the balloon back out, and then that's how they're able to remove that tube. For the person with the low profile device, they also have a balloon port on the side, and it says BAL on it. So you know, if you're a staff assisting this person with their feeding tube, you're never gonna connect to the port that says BAL, okay? You're always gonna stay away from that port. You're not gonna do anything with that, only the nurse does something with the balloon port. So the port that you would be connecting to would be the larger port that doesn't have the color-coded ring, okay? So instead of the colored ring, we're going to use the other port to put any fluids or medications in. If we have a tube like this, the same theory. The balloon that you're not going to do anything with is the colored end, and then the other part is where you would be putting the medications. If a person has two separate tubes plus the balloon port on the end of their tube, you want to make sure that you're putting whatever into the person through the right port. So if that person's MAR says that they need to get feeding or medications through their J tube, then you would have to make sure that you find the end that says J tube. If the MAR says it goes into the G tube and there's two ends, you would find the one that says G, and that would be the one that you would give the feeding or the medications into. I'm going to go ahead and show you how, with a person who has a low profile device, how we utilize that and assist that person with their daily needs. I would make sure that I've looked at the MAR and I know what I'm gonna go ahead and give that person, that I've got the right person. I'm following those rights of med administration. So the person, the dose, the time, the medication, the route, all of these things I'm gonna follow so that I give the person what they're supposed to get at the right time based on what their physician has ordered. So let's go ahead and say for Jim that his physician has ordered for him to get 100 cc's of water at 2 p.m. and it's 2 p.m. Well, in that scenario, the first thing I want to do with Jim is I'm going to let him know, hey Jim, it's time for me to give your water flush. I'm going to go get it ready and then I'll be back. I'm going to go ahead and put you up at 30 degrees so that we can prevent you from aspirating on anything that I give you. So then at that point, I'm gonna raise his head to at least 30 degrees. I can go beyond 30 degrees, but I'm gonna be at a minimum of 30 degrees because where that esophagus and airway are sitting are right next to each other. So I don't want things to come back up out of the stomach through the esophagus and end up in that person's airway. So if I put him upright for 30 minutes before I give anything to him at least 30 degrees or more, we're gonna have less risk of something going into the airway that shouldn't be going into the airway. So I'm gonna go into the med room and I look at my MAR and it says that I need to give 100 cc's of water. So what I like to do is I always have just a pitcher of water at room temperature. I fill that in the morning if I'm the person passing meds. So I've got my pitcher filled with room temperature water. And what I wanna do is just find on my graduated cylinder where the 100 cc line is. So I know that's how much fluid I need to give Jim right now. So I'm gonna go ahead and set it down. I can see where my line is, and I'm just gonna fill it to that 100 cc line. So this is how much fluid I need to give. The other thing that I need to bring is the extension to give the feeding with, the water, and a syringe, okay? All right, Jim, I'm back. I'm gonna go ahead and give your flush to you now, okay? I wanna do my hand hygiene. If I have a sink, I'm gonna use warm water and wash my hands with soap and water for 20 seconds. I don't have a sink right now, so I'm gonna go ahead and use my hand sanitizer, get a good sized pump. I'm gonna rub that all over my hands, and I'm gonna keep rubbing it vigorously until my hands are dry. Once my hands are dry, then I can go find my gloves, and I'm gonna go ahead and put my gloves on. I always wanna wear gloves anytime I'm gonna be working with a feeding tube. It's also important to know that if you're gonna be helping one person with their feeding and then a different person, you're gonna make sure to do hand hygiene in between people and put on a new pair of gloves with the next person that you assist. So I've got my gloves on. We've talked about what I'm doing. He's been up for 30 minutes at least a 30-degree angle. Generally, what we like to do when we're going to give a person feeding is we want to make sure that their tube, we don't want to give them too much air or anything like that. But what I'm going to do is I've got a 60 cc syringe. I'm going to go ahead and fill that with water because I know I'm giving a total of 100 cc's of water. I can fill that with water. I can connect my syringe here to the end of this extension. I'm gonna leave this open because I'm gonna push water through this line, okay? So I'm just gonna slowly push on the end of the syringe with my hand, and we can see the water coming all the way to the other end of the extension. There we go. Now I'm gonna clamp my extension tubing. I clamp it just by taking my thumb and my index finger and bringing them together tightly over the clamp. Now I've got it clamped, I've got it full of water, and the reason I want to fill it with water is I don't want to push this full of just air into Jim's stomach because that's going to create gas and can be uncomfortable for him. So I've got it ready to go with water, okay? Then I'm going to come to the site and get it connected. So I can go ahead and unsnap the top. Now I'm going to line up my lines and then I will twist in a clockwise motion. So I've lined them up. I've twisted, so I'm locked securely in position. The other thing that I like, and this is just personal preference for me, is to have a towel nearby and lay that near where I'm going to be giving the person the feeding or flush. The reason is that sometimes this can be a messy process. I don't want to get the person's clothing soiled or wet because a little bit of a droplet comes out and onto them and makes them cold or uncomfortable. So I'm going to do my best to make sure that they're covered up where I'm going to be working and where there's a potential for water to come out. Then what I'm going to be doing is I'm going to go ahead and I'm going to unclamp the tube. When I unclamp the tube, so we've got the clamp right here, all it is just a thumb brush movement forward. So I just brush that forward with my thumb. That unclamps it. Okay, so now it's open. Now I can go ahead and just start slowly putting all this water into the person. So my job right now is to make sure that I give all the water from here into the feeding tube. So I'm just slowly going to do that over the next 10 minutes. Once I'm done, I'll disconnect. Okay, so I've given the total 100 cc's slowly into the syringe, and now I can just go ahead and first I can clamp my tube here. I can disconnect my syringe, set that aside, and now I can go ahead and disconnect my extension. There, in that scenario, I've given the person that full 100 cc water flush. I had them up at 30 degrees, and I'm gonna have them stay at that for at least 30 minutes after to prevent that water from coming up and going into the airway. Now, what do I need to do if it's a person where I need to give them water, plus I need to give them a medication? Let's go ahead and run through that process. Let's start with our hand hygiene. Typical process, if you have a sink and warm water and soap, then you're gonna wanna use that for 20 seconds. I don't, so I'm gonna use a good pump of hand sanitizer. I'm gonna vigorously rub that into my hands until my hands are completely dry. Once they're dry, I'm going to go ahead and get my gloves on, okay? So I'm looking at the MAR, and the MAR tells me that I need to give Jim Johnson a hydrocodone 5 by 325 milligram tablet. So that's what the MAR is telling me. So I go into my medication cart and I pull out that blister pack. So I know this is the medication I need to give. Now I want to make sure and verify those 5 rights at least 2 times before I give the med to the person. And then I'm going to come back after I've given it, double check the 5 rights again, and then I'll document the administration. So let's go ahead and run through those 5 rights. So the right person is Jim Johnson. The right medication, hydrocodone. Then I've got 5 325, and I need to give 1 pill. So that's my medication, my dose. I've got the route is going to be via the G-tube. The time is 2 p.m. Okay, so I want to make sure that I'm getting all the rights of administration covered. So I've checked that. I'm going to run through that one more time before I remove the pill. So once again, I've got Jim Johnson, hydrocodone, 5 325. I'm going to give that via G-tube at 2 p.m. So I've checked that. Now I want to go and remove the correct dose for today. So I've got the correct pill. The next step is I need to put it into my crusher, because if it's going to go into the feeding tube, it's not going to work as a full pill. So I'm going to go ahead and set my blister pack aside for a second. I know I've checked my rights of administration with the MAR, and I'm going to open my pill crusher. With this type of pill crusher, it's literally just unscrewing the top. I'm going to put the pill right in here, and then I'm slowly going to twist the top down until I have the pill completely crushed. Once it's all the way crushed, it will be sitting in the bottom of the crusher and I'll be able to see it there, okay? So I'm gonna take the pill in the blister pack. I can see on the front of the blister pack the day that I'm removing. I can also look at the back, and the number of that day is listed there as well. So I can line up the back of the pack over my pill crusher, pop the pill right into there. Now it's ready for me to go ahead and crush the medication, and I'm just twisting, tightening that down. Then I like to go back a little bit, shake it a little bit, tap the sides, and crush again. So go back down tightly. Now I can go ahead and check by removing the top to see, did I get all the medication crushed and into the bottom? So now if we look, we can see it's all crushed in the bottom of the cup. So I'm ready to go ahead and get ready to administer this medication. I'm gonna go ahead and twist the top back on. And once the top is on with this type of crusher, I'm basically kind of doing a peel like you almost would a banana, and very carefully, because I've got the med down here, I don't want that to go everywhere. So I'm always going to be very careful as I'm peeling that top off, okay? Gotten the top off, I can set that aside. Now I've got that medication. I'm going to go ahead and put that into a plastic medication cup. I want to use a plastic medication cup because I'm going to mix it with water and then suck it up into the syringe, okay? So now, just tapping it all in there until I get all of the medication out of the crusher. I can set that aside. I'll wash this crusher when I'm done. If I'm going to use it for someone else, I make sure and wash it in between. Now I've got the medication in my pill cup. This medication, I can't just pour into the feeding tube, it won't go anywhere. I've got to mix it with liquid and help it dissolve so that I can put it into the feeding tube. So I'm going to look at the bar and I'm going to see, and I look and I see that for Jim, I need to give 100 cc water flush. So I'm going to go ahead and put 100 cc's in my graduated cylinder, just like I did last time. I just set it down, and I want to make sure that I've got that full 100 cc's. Once I've got that in there, now I know by the time I'm done with Jim's medications, I need to make sure I've given all of this fluid, and I will have met his fluid order for the fluid flush, okay? So as long as by the time I'm done in his room, we've used up this water into the feeding tube, I've met that order for the flush, okay? So I can actually take this 100 cc's and pour about a half a med cup of it in with that crushed pill. So I can use some of this water for the flush to mix with the med, because this is going to end up going into his body. I'm just going to take my syringe. I've got it pushed together. I take the tip, put it right down into the med cup, and I'm going to stir that. Not so much to the point where it's going to come out and fly around the sides. I want to keep the medication and the water in the cup, but I'm stirring it to help dissolve the medication with the water. And I'm trying to, if I see any pieces that need to be broken up, I can push the syringe against the side to help break those pieces up. If there's any of it stuck to the bottom, I just take the syringe and rub it right along any spots that are stuck. So I'm going to do that until I've got it well and mixed together. Once it's all mixed together, I can go ahead, and my process for this, I like to suck it up with the cup tipped slightly, and then I just use my thumb slowly pulling back on the syringe until I get all of that medication out of there. What you'll notice is that even when you do that, sometimes there's still sediment from that medication in there. I want that person to get the entire amount of medication the doctor ordered. So I'm going to add a little bit more water. Once again, I need to use all this water by the time I'm done. And I'm just going to go back into the container, swirl it around, and suck it up. Finish sucking it up and stirring around. Now I've got it all in here. I can take my syringe at this point, kind of pat it on the side to get any air bubbles out that are at the top. I can see that I've got air from about where the top of my finger is up to here. I'm going to slowly push that extra air out, okay? So that all I have in my tube is the medication that I need to give the person. Okay, so I've checked the 5 rights. This med is ready to be given to Jim. So I'm going to get that med. Then I'm going to get his flush syringe that I use just to flush water into him, and the container with the water that I need to give. Going into Jim's room, hey Jim, I've got your medication and your water flush. I'm going to go ahead and give those now. I'm already connected and I've got water in here, so I'm ready to connect. The first thing I want to do before I give a medication or a feeding to anybody is I want to flush their tube with 30 cc's of water. The reason that I'm doing that, 30 cc's of water, is because I basically want to make sure the whole tube is cleaned out before I put a med in there. If it's not cleaned out, that med might congeal or get stuck in there with whatever is clogging the tube, and then I might not be able to get anything moving through the tube. So we're going to start with a 30 cc flush. I'm just connecting my syringe to the end, just like I did before. I'm going to unclamp by doing that thumb motion. That's going to unclamp the tube. And then I'm going to slowly, with the tube upright, push that fluid in there until I've inserted all 30 cc's of the syringe into the feeding tube. Okay? And like we said before, this is room temperature water, so it's not going to cause any discomfort for this person. It's not too hot and it's not too cold. So I'm just going to slowly do that. Okay, I've finished putting the 30 cc water flush in. Now I'm going to go ahead and clamp the tube. I'm going to untwist the syringe that was for the water flush, set that aside. Now I've got my syringe with my medication in it. I can go ahead and put my finger over the top and I can just shake that up, because if any of the med has settled in the syringe, this is going to give it the opportunity to kind of spread throughout. Now I'm going to go ahead and connect it to the tube, just like I did with the water flush. I'm going to unclamp, and I'm gonna slowly push this medication in over the next 30 to 60 seconds, okay? So just slowly doing that. Okay, so I've pushed all of the medication into the tube. Now I wanna clamp the tube again. The reason I'm clamping the tube is if I don't, it's possible for stomach contents to come out of the stomach and come out of the tube, and that can make quite a mess and not be comfortable for anyone. So you'll get used to the fact that you wanna make sure and clamp that tube in between things that you're doing. But all it takes is forgetting one time and you learn a very valuable lesson and remember it in the future. So we've given the medication, it's all in the feeding tube. The final thing I need to do is make sure that I give the rest of the 100 cc flush. But at the end, whenever I'm done doing something with a feeding tube, I wanna make sure I flush it with at least 30 cc's of water. The reason is, if I only flush with 10 cc's of water, all of that medication might not get into the stomach or into the jejunum to do its work. So I need to make sure I get the tube totally flushed with water so all of the medication or all of the feeding gets into the body. We've given the med. I can disconnect that. I can grab my syringe to do the flush, and I'm just going to suck up the rest of the water. And if you kind of tilt the container to its side, you'll find that you can, that's one of the best ways with your thumb to come up and suck that solution right up into your container. So I'm just pushing here on the syringe with my thumb and pulling on the back end of the syringe with these fingers on this cap here, and that's how I'm sucking it up in there with one hand. Now I've got the rest of the water flush in the syringe. I want to push out the air at the top, so I can go ahead and tap it. And I'm going to do the same thing I did before. My thumb and my forefinger are going to pull onto here. My other part of my hand is going to hold the other end, and I'm just pulling down with my thumb and my index finger until I get the water all the way to the top. Now I'm ready to do the final flush. So I definitely have my 30 cc's of water, which I always need to finish with. I've got it clamped. I'm just going to unclamp it, and I'm slowly going to be giving this fluid until I get the tube all the way cleaned out. I've finished slowly pushing in that final 30 cc flush. You can see my syringe is empty. I'm gonna go ahead and clamp again, clamp down, disconnect my syringe just by twisting and pulling back. Now, I've done everything I needed to, so I can go ahead and disconnect from the feeding tube as well. So in that scenario, I just wanna line up the lines and disconnect. So this, I can just go place on a dry paper towel. I had finished flushing it with water, so that can just dry. That extension can lay out and dry until the next time I need it. Now we've gone through how to do a medication and a water flush through a feeding tube. Let's go ahead and talk about how to actually give feeding into the feeding tube. There's a couple different ways to do it if a person gets a bolus feeding. We talked earlier about if a person is getting a bolus feeding, bolus being a large amount in a small amount of time, it's likely going into a G tube or the gastric area, the stomach. Okay, so that's what we're going to do right now is give someone feeding into their stomach. They have a G tube. I've gone and I've checked the MAR and I see that they need to have Gevity, 1.5 cal, and they need to get 8 fluid ounces. And that's exactly how much is in my container. So I've gone to the MAR, I've got the right person, I've checked what I'm giving, everything matches up. Now I need to go give it to the person. Let's look at the different ways that we can do this. One thing we know that we learned earlier is I have to give at least 30 cc's of water before I put something in the tube. And when I'm all done putting something in the tube, I need another 30 cc's to flush it with. So I'm going to take my graduated cylinder and I'm going to put at least 60 cc's of water in there. It's fine if there's more than that because I don't have to use it all. I know that I need to use 30 cc's when I start and 30 cc's when I finish. So I've got my graduated cylinder with enough water to do my before and after flush. I've got the feeding that I'm going to use, and I'm also going to need a syringe. Come to the person, hey, I'm going to go ahead and give your feeding now. I'm going to just wash my hands real quick. I don't have a sink, so I'm not able to use hot water and soap to wash my hands, so I'm gonna go ahead and use hand sanitizer. I'm gonna get a good dollop into my hand, rub it all around vigorously until it's dried. Once it's all dry and I've rubbed it in really well, I can go ahead and put my gloves on. I'm always gonna wear gloves when I'm doing something like this. Doing anything via the feeding tube can get messy, and you're dealing with bodily fluids, so you should be protecting yourself and the person you're caring for by having your protective equipment. I've got the site. I'm gonna put a towel underneath because for me, I always worry about having anything leak, and I don't want that to leak on the person. So no matter what I'm doing with a feeding tube, I'm always having that towel underneath the tube in case anything drips out, so I don't get the person's clothes messed up, or I don't cause them to be uncomfortable by having wet things on them. I've got the feeding, I've got my water, I've got my syringe, and I can go ahead and connect now and do my first flush. I've already made sure that we're at least at 30 degrees, and this person has been up at 30 degrees for at least 30 minutes before I come in to do this. I'm gonna suck up 30 cc's into my syringe. That's gonna be my pre-flush with water, and I'm gonna instill that into the feeding tube to make sure that it's open and working properly. I'm gonna go ahead and give your feeding now, okay? I'm gonna flush with 30 cc's of water first. So I can go ahead, if there's a clamp on the tube, I would connect my syringe, then I would unclamp it. If there's not a clamp, what I can do at that point is between my thumb and index finger, I can just use these to clamp the tube in between things that I'm doing. So I'm connected, so I'll go ahead and flush in the 30 cc's first. I'm watching the person to make sure there's no signs of discomfort or like anything is going wrong. I'm looking at the site to make sure everything looks like it's going okay, it's not coming back out. So there's no indications that there's any issues with this, and I'm just slowly giving that water flush into the body. Once I've given the full amount of water flush, I can go ahead and kink the tube with my thumb and my index finger. Now I've got my syringe. Like I said, there's a few different ways that you could do a bolus feeding. One of them is actually by taking the syringe apart and just placing this part into the site. I'm still clamped at the tube with my thumb and my index finger. Now we know I need to give this full container of feeding. So I'm gonna go ahead and unscrew the cap. You get really good at using one hand for things with a feeding tube. And I'm gonna just pour this solution in here, okay? And then I'm gonna unclamp my fingers, and so this is a gravity bolus feeding that I'm doing via syringe. And once I release my fingers, that water quickly, now I can clamp it again because I have more to give. Now I can put the rest into the syringe. Once I release, it's gonna quickly go in there. So keep an eye on the syringe. And I can control how quickly it goes in there by clamping, but also how close I am to the person's body will slow how it goes into how quickly it goes into them. So the closer I am to them, the slower it will go. The higher I get up, the faster it goes, okay? I'm gonna clamp again because I've got a little bit of the feeding left to give from the container. Go ahead and pour that in. And I'm gonna let that last little bit run in. Okay, clamping again. Now I'm gonna disconnect my syringe here. What I wanna do now is my 30 cc flush after the feeding to make sure that all of the feeding is into the body and into the person. So I'm just gonna suck up 30 cc's into my syringe. I'm still clamping with my other hand. Turn it upside down. We're gonna push out that extra air. Connect it to the tube. We're gonna flush in that 30 cc's. Once we get that in there, clamp it again with my fingers. I could disconnect, and then if there's a cap that goes on their feeding tube, I would go ahead and place that now. So I've gone ahead, I've given them the flush, the 30 cc's before, then the feeding. I flushed with 30 cc's after. That's how we did the first type of a bolus feeding via syringe. The next type would be, instead of separating the syringe out, would be just to suck up the feeding into the syringe. It's got the plunger in it. and I would just slowly push the feeding into the person. So instead of letting gravity do the work, I'm just slowly using my thumb to push the feeding into the person. Once I've got all the feeding in, then I would finish up with my 30 cc flush. So those are two of the ways to do a bolus feeding. The other type is just to have a bag that you pour the feeding into and you connect the line to the feeding tube and it slowly runs in via the bag. The important thing to know about the bag is the bag has a dial on it that you can increase the flow or decrease it to that person's comfort level. We always want to make sure that whether it's 100 cc's to 300 cc's of a bolus feeding, we give it slowly over time. It shouldn't be a 2-minute process. It should take us about 10 minutes to get that feeding into that person, just to be safe and keep them comfortable. So there it is. That's how you give medications or feeding via the feeding tube. Another important thing to remember is if a person isn't taking anything in my mouth, we need to do oral care at least every 2 hours. The best way to do that is to get yourself a toothette. Just going to take it out of the container, put a little bit of water into a tiny cup. Just going to dunk the end of the toothette into there and you can squeeze it out. And then we're just going to brush that all the way around the mouth, kind of like you do with a toothbrush. And what we're doing is we're moistening the mouth all the way around, all over the teeth, all over the outside of the teeth, the top and the bottom, the top of the mouth, and the tongue. So we're moistening the mouth, but also we're helping to clear bacteria out of the mouth for that person. Thank you so much for watching.